morning, Dr. Patino here at the Cosmetic Surgery. We're going to do micro-assisted liposuction to all the back areas and a fat transfer to the buttocks. The patient is on the side. This is an electric tool, micro-assisted, so it's like an electric toothbrush, right? You don't have to use this like an old toothbrush where, you know, you're jamming that toothbrush back and forth, and that's what's going to happen. If you go forcefully, you are going to get gum bleeding, right? In the same manner, the fact that I have this electric tool doesn't mean that I'm going to use it appropriately, right? So if you go at this like an old toothbrush, very fast with very fast strokes, there is going to be bleeding. But what do you see here? What's coming out, Silvita?
Yellow fat.
Yellow fat. And you know, I'm using my non-dominant hand, so I'm ambidextrous, and most surgeons are ambidextrous, but if you're not, you know, I encourage you to train yourself to be ambidextrous and use your non-dominant hand also. I use it 50% of the time. That way, it will kind of force you to go slow, right? And that's going to be good for the patient because you're going to get this aspirate. Look, yellow, beautiful aspirate. Of course, there's a lot of things that go into it, but also much less risk of perforating an internal organ, something that has never happened to us. But it usually does happen to a petite surgeon that's going at full speed, maybe on a Friday afternoon, just like today, right? Today's Friday morning, but maybe after many cases, we just do 1 or 2 at the most, instead of doing 10, 13 cases a day. There's doctors that do that, and of course, and I compare this to driving a car, an automobile on the freeway, right? If you're tired at the end of a busy week, and you've been working a lot, and you go at full speed, maybe at night, and then you may lose situational awareness and go to an unintended area and crash. This is exactly what happens to the surgeon when they perforate an internal organ. Thank you. Yeah, so, but it's also good for the surgeon because, you know, if you're using both hands 50% of the time on the right side, the 50% of the time you're using your left hand, then you're also, the surgeon is going to have less risk of occupational injuries, like tendinitis of the wrist or elbow or shoulder, right? And also, the patient also benefits because not only is much less risk of internal organ injury, something that we never done, thanks to God, but also less risk of oil cysts because very aggressive, very fast, aggressive cannulas and fast strokes lead to oil in the fat. So here, this one has absolutely no oil, right? Or bleeding. And both of those things, when you put oil into the buttocks is going to reject it. And it's going to create a cyst, oil cyst. Thank you. So this is her buttocks over here. Patient is on her side. We're just doing the back side. This is the waist. Look how we gave her a very nice waist. And
beautiful.
This is what we call the pinch test. You see how she is really down to nothing, 0.5 centimeters everywhere we go. You see? Very good. See? Here too. So not much excess fat or excess skin anywhere we touch her. See? That's called the pinch test, and it's part of the surgery. Thank you. This bloodless, oilless fat is the one that's going to go into her buttocks. That's the fat graft. And so if you put oil, you're going to have oil cysts. If you put fat with blood, you're going to have probably a blowout reaction. A blowout fracture, which is a foreign body reaction that the body rejects that blood and pushes it out. You have like a deformity in your buttock, like a light bulb sticking out of the butt, and that's called a blowout fracture. And I believe part of it is that it is a foreign body reaction because the body rejects that blood that doesn't belong in there, but part of it also is distraction by the surgeon of the superficial gluteal fascia, something that we don't do here. We do it under ultrasound. You'll see it. So this beautiful fat graft that's being taken out has not been processed in any way, and it will be re-injected back into her buttocks. But the key is to get an atraumatic, bloodless, oilless fat graft to begin with. Thank you. Wow, so look how comfortable I am, and my strokes are very slow, calculated. It's impossible for me to go inside the thoracic cavity if I'm going like this at this pace. It's just impossible. Beautiful fat graft, thank you. Look how slow and calculated my strokes are. I would say it would be pretty impossible for me to penetrate and injure an internal organ. If you're doing this way, I'm not sweating it, I'm not at full speed, just gently going through the tissues without any rush here. We just take real good care of our patients. We're not, in mass production or anything like that. It's just a very, very good and meticulous, calculated movement. So many advantages for the patient and advantages for the surgeon as well. It's stressful to work in a clinic where you have 10 patients to operate on, and you have to go very fast, and that's when things go wrong, I believe. Here, it's very, very controlled. Everything that we do, we're almost done with the surgery. We're basically are in the half. Maybe we got another hour, and that's it. But look how beautiful this is, without any bruising, no bleeding, very smooth. And look at me now. Look at me. Look how comfortable I am, right? I'm not sweating. I'm not, overdoing it. It's very, very happy and very comfortable. Thank you so very much for watching. So this is ultrasound guided gluteal fat transfer. I'm looking at the patient. I'm looking at what's going in, that bloodless, oilless fat graft. And I'm also, of course, looking at the ultrasound. We're doing this according to the World Association of Gluteal Surgeons guidelines to keep this procedure safe, to put the fat graft precisely where it belongs, in the deep subcutaneous space between the deep gluteal fascia and the superficial gluteal fascia. For those doctors watching out there, notice the bloodless and oilless fat graft. Then I do 100 on one side, then I move to the other buttock so that we can keep the fat graft symmetrical. 100?
Yes.
Okay, so we're going to move to the other side. Thank you. And this fat graft has not been processed in any way. We just collected it on 500 ml of normal saline, but it hasn't been treated with any commercially available system. So what you see is basically what I obtained with the aspiration, and that's very, very good, because the fat graft survival, of course, is going to be better if the surgeon injects something that looks red or pink. Well, the surgeon is injecting blood into the mix, so obviously that blood is going to be reabsorbed, and or oil, right? The oil may be rejected, the blood may be rejected, you may end up with a blowout fracture or an oil cyst. Thank you. So we got 100 on this side, and now we'll move to the other side. Thank you.
Cannula. Right, so we are doing the ultrasound guided gluteal fat transfer again. This is the skin right up here, and then the superficial gluteal fascia is this bright white line. Dr. Patino's cannula is right here. He's wiggling it for us. The deep gluteal fascia is right here, and below that is the no-go zone, which is the muscle. We want to stay away from there and not inject the fat in there.
The striated muscle. So I'm going to wiggle the catheter and look at the tip of that cannula right there.
All right, here's the
So
tip.
I'm going to withdraw it a little bit, and I'm going to inject. 1, 2, 3, go. You see a cloud of fat.
So there's a cloud of fat going into the subcutaneous space, and as his cannula is pulling out. Thank you.
Okay, so we're done. Look how beautiful she looks. She said she never had a butt. Now she got a butt. She's very happy. I told her she may need an open buttock lift because she has some
depressions and irregularities, but guess what? I think she's gonna do okay just with the fat transfer. We'll see how she does. But she looks incredible, very beautiful, rounded, beautiful buttocks with nice projection and an athletic back as well. So we just did liposuction to the back and a fat transfer to the buttocks under ultrasound guidance here at the Cosmetic Surgery of Cerrito. If you would like to have a procedure like this, please give us a call, 510-525-7999. Operators are standing by!